Hi everyone. Today in this video we are going to discuss the comparisons between Tramadol versus Trazodone. These two drugs, Tramadol and Trazodone, are somewhat similar and both of these drugs are acting on the CNS, but both of these drugs are available under different brand names and they are belonging to the different categories. Tramadol is well known with the brand name Ultram, whereas Trazodone is well known with different brand names. Among them, Desirel is one of the brand. But still both of these drugs are starting with similar letters, which is somewhat confusing. So when we see these two drugs, Tramadol and Trazodone, we may get a confusion about what is their clinical use and what is their category. Tramadol is particularly used for the treatment of chronic pain, but it can be used for a short period. In the conditions like moderate to severe pain, Tramadol can be used when other analgesics are ineffective. Whereas Trazodone can be used as an antidepressant for the treatment of major depressive disorder. So we can see that both of these drugs are different, but still they have so many similarities. And one of the important similarities is that both of these drugs can increase the serotonergic transmission within the CNS. So 5-HT levels are elevated within the brain by use of Tramadol as well as Trazodone. Apart from these similarities, both of these drugs belonging to the different clinical category. Tramadol is an opioid and it is a weak opioid which can be used to treat moderate to severe pain with less addiction compared with strong opioids. Whereas Trazodone is a different drug, it is an antidepressant, but few of the opioids are also having the similar suffix as Trazodone. For instance, oxycodone is one of the opioid which is having the similar suffix like Trazodone, but Trazodone is not an opioid. Trazodone is an SSRI, selective serotonin reuptake inhibitor. So because of similarity in their names as well as their pharmacological actions, these two drugs may be confused. So today in this video we are going to see the various types of similarities and differences between these two drugs, Tramadol and Trazodone. First of all, let us start with the mode of action. Both Tramadol and Trazodone having some similarities in their mode of action. Being an opioid, Tramadol acts on the opioid transmission. Few of the opioid peptides can be stored into the presynaptic neurons, which can act on the postsynaptic neurons that are expressed with opioid receptors like mu receptors. Now when these opioid peptides are released, they can act on the mu receptors. These mu receptors are inhibitory in nature. They can reduce the pain transmission, thereby they can reduce the nociception. Now Tramadol can act on these mu receptors as agonist, thereby it can reduce the nociception. Apart from this, the pain signaling can also be controlled by another mediator 5-HT. Few of the descending neurons like serotonin can store the 5-HT. This 5-HT can be released and it can act on 5-HT receptors, which produce again inhibition on pain transmission. But the action of 5-HT can be controlled by its reuptake. So the released 5-HT can be taken back into the nerve terminal, which reduces its activity. Now Tramadol can block these reuptake transporters so that it can inhibit the reuptake of 5-HT. When these transporters are blocked, 5-HT cannot be taken into the nerve terminal. So this increases the 5-HT levels within the synaptic cleft. In this way, Tramadol can reduce the reuptake of 5-HT as well as it can act as opioid agonist. Now if we see the Trazodone is an SSRI. It can act on the serotonin neurons. So on the postsynaptic neuron, serotonergic receptors like 5-HT2 are expressed. Now when the 5-HT is released, it can act on 5-HT2 receptors which produce excitation. Again, the released 5-HT can be taken back into the nerve terminal by reuptake transporter like SERT, serotonin reuptake transporter. Through this transporter, 5-HT can be taken back into the nerve terminal, which reduces its neurotransmission. Now Trazodone can block this SERT so that the 5-HT cannot be taken into the nerve terminal, which increase the 5-HT levels within the synaptic cleft. So here we can see that both Tramadol as well as Trazodone can block the reuptake of 5-HT. So they are having some similarity in their mechanism of action. But Tramadol is used to control the pain, whereas Trazodone is used to control depressive symptoms. It is very interesting that even both of these drugs are having a similar mechanism. Their target of action is different, so they are having different clinical uses. Second point is the effect on sleep. Trazodone is an antidepressant, but it can be used to treat the insomnia at low dose. Normally, it can be given at low dose range such as 25 to 100 mg in order to treat the insomnia. So apart from antidepressant activity, Trazodone can be used as a sleeping aid to induce the sleep. On the other hand, Tramadol is not indicated for insomnia, but still it can induce the sleep and it can produce some sedation. Since Tramadol is an opioid, it can produce some sedation, dizziness and drowsiness, but still it is not indicated for the treatment of insomnia. So both of these drugs can produce sedation and drowsiness in the patients. That's why both Tramadol and Trazodone should not be combined with alcohol because it further increases the drowsiness in the patients. Third difference is the clinical uses. Already we have discussed that Tramadol is an opioid. It is particularly used to control moderate to severe pain that is not controlled by non-steroidal anti-inflammatory agents. On the other hand, Trazodone is an SSRI. It is particularly used to control major depressive disorder. Apart from this clinical use, Trazodone can also be used as sleeping aid in order to treat the insomnia. Fourth one is elevation of QT interval. Here Trazodone plays a significant role. With use of Trazodone, we can observe an elevation of QT interval within the ECG, which can induce some significant cardiac arrhythmias. This is particularly observed at doses greater than 100 mg, which is a common dose that can be used in many of the people to treat depression. The risk of elevation of QT interval can be further pronounced by use of other drugs like class 1A antiarrhythmic agents and class 3 antiarrhythmic agents, which are proarrhythmic in nature, which can further increase the QT interval within the ECG. So with such type of drugs, Trazodone should be carefully used. On the other hand, Tramadol is not increasing the QT interval at normal doses, but at higher doses, Tramadol can also increase the QT interval. So it can induce significant cardiac arrhythmias at overdose, but at normal dose, it is not inducing any increase in the QT interval. So this is another difference between the Tramadol and Trazodone. Even both of these drugs can increase the QT interval, but the risk is more pronounced with use of Trazodone. Fifth one is the doses. Tramadol is available as an extended release capsule, and the initial dose is started at 100 mg given once daily, and the usual dose range is variable from 100 to 300 mg per day. On the other hand, Trazodone is available as a tablet. It can be given at a dose of 150 mg initially, and the dose range is variable from 150 mg to 400 mg per day. Even Trazodone can also be given up to 600 mg in few of the patients, but above 600 mg it should not be used. And if we see, the dose of these two drugs are also somewhat nearer. Sixth one is the side effects. As Tramadol as well as Trazodone act as CNS depressants, they can produce few of the common side effects which are similar to both of these drugs. Because of CNS depression, they can produce drowsiness, somnolence, sleepiness in the people. Dry mouth and nausea are produced by Tramadol and Trazodone. Since Tramadol is an opioid, it particularly produces constipation as it reduces the GI motility, whereas Trazodone can produce diarrhea, the quite opposite effect produced by Tramadol. Similarly, Trazodone can also produce hypotension, particularly orthostatic hypotension, because of block of alpha-1 receptors, and it can also produce some weight loss because of elevation of serotonin levels. So elevation of serotonin levels is more pronounced in the Trazodone compared with Tramadol. Seventh one is the risk of seizures. At this position, Tramadol shows its effect. Being an opioid, even at usual dose, Tramadol can inhibit the neuronal transmission within the CNS, which may reduce the seizure threshold, so seizures may be more pronounced with use of Tramadol. On the other hand, Trazodone is not producing the seizures at usual dose, but at overdose it can induce the seizures. Otherwise, in those conditions like hyponatremia, Trazodone can induce the seizures. So the risk of seizures are more pronounced with use of Tramadol compared with Trazodone. When to avoid? What are the contraindications of Tramadol? Being an opioid, it can produce some respiratory depression. So Tramadol is contraindicated in the people with severe bronchial asthma. And since Tramadol can increase the histamine-like reactions in the people with severe pruritus and hypersensitivity towards the Tramadol, this drug should be avoided. Similarly, the people with high risk of epilepsy, Tramadol should be avoided because this drug can increase the risk of seizures in such people. Now, if we see the contraindication of Trazodone, it is particularly contraindicated with MAO inhibitors because MAO inhibitors can induce one of the conditions Serotonin Syndrome because of elevation of IST levels when they are combined with Trazodone. That's why there should be at least 14 days gap between the use of MAO inhibitors and Trazodone in order to eliminate Serotonin Syndrome. Similarly, the conditions like severe glaucoma, Trazodone should be avoided, and in the severe cardiac arrhythmias, again this drug should be avoided. Ninth one is the Serotonin Syndrome. Both Tramadol as well as Trazodone can increase the 5-HT levels within the CNS, so they can induce Serotonin Syndrome, resulting in if you have the symptoms like hyperthermia, elevated body temperature, muscle rigidity, tachycardia, increased rate of contraction, and some state of confusion can be produced by both of these drugs. But Serotonin Syndrome is not observed at normal dose. When these drugs are combined with other drugs which further increase the 5-HT levels, they can induce Serotonin Syndrome. 10th one is the drug interactions. Tramadol shows drug interactions with few of the antidepressants like SSRIs, selective serotonin reuptake inhibitors, SNRIs, selective norepinephrine reuptake inhibitors, and MAO inhibitors. All these antidepressants, when they are combined with Tramadol, they can induce the risk of seizures. Trazodone is an SSRI. It is having few other drug interactions with other drugs. Particularly, it is having significant drug interaction with MAO inhibitors. That's why 14 days gap should be maintained between the use of Trazodone and MAO inhibitors. Similarly, few other drugs like barbiturates and CNS depressants can induce severe depressive effects on the brain, resulting in drowsiness, sleepiness. Even at higher doses, they can induce coma and death. That's why Trazodone should be carefully combined with other CNS depressants. So these are the similarities between Tramadol and Trazodone. At many of the points, both of these drugs show similarities. Both of these drugs act on the CNS and they depress the CNS, as well as they can increase the serotonin levels within the CNS. And both of these drugs can produce sedation, sleepiness, and drowsiness in the people. But the risk of seizures is more pronounced with Tramadol, and risk of elevation in the QT interval is more pronounced with Trazodone. Tramadol can produce constipation, whereas Trazodone can produce diarrhea. In this way, these two drugs are looking similar, acting similar, but they are indicated for different purpose. Tramadol is an opioid indicated for control of moderate to severe pain, whereas Trazodone is an SSRI. It is particularly used to treat depression, as well as it can also be used to treat the insomnia. So that's all about the differences and similarities between Tramadol and Trazodone. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.